Good morning. Today our topic is anatomy of retina. First we are discussing about the gross anatomy. Retina is extend is from optic disc to ora serrata and surface area is about 266 millimeter square. And thickness at the posterior pole in the peripapillary region is approximately 0.56 millimeter and at equator 0.18 to 0.2 and ora serrata it's 0.1 millimeter. In color, purplish red due to visual purple of the rods. And after death of a person, the retina appears white opaque. And grossly, the fundus can be divided into three regions like optic disc, macula lutea, and peripheral retina. That is general fundus. So, gross anatomy of retina. This is ora serrata. This is the macula, and this is the optic disc. We'll discuss later. This is the optic fovea, optic nerve. This is the optic disc. Next, optic disc. It's a pale pink circular area, well defined circular area, 1.5 millimeter diameter. Color, it's uniformly pink and the tint shows considerable variation. The optic disc called the retinal layers terminate except the nerve fiber layer. That nerve fiber layer passes through the lamina cribrosa to run into the optic nerve. And in comparison to the rest of the retina, the optic nerve appears pale due to lamina cribrosa and mediated nerve fiber behind it and absence of vascular corridors. In center, where the nerve fibers are thinnest, the white lamina shines more brightly. The gray spots in the lamina, when they are seen, are due to non-medullary nerve fibers reflecting less light than the white connective tissue fibers. Physiological cup of the optic disc is a depression seen in the optic disc, and the central retinal vessel merge through center of this cup, and the cup varies in size, shape, position, and depth in different eyes. And sometimes there is scarcely any physiological cup, in which case the disc is more uniformly pink, and the central vessel may have already divided before they come into the surface. And increase in size of the cup and difference in size cup ratio, we should between both eyes, two eyes, we should investigate it. In that case, we should investigate it to exclude glaucoma. Next is macula lutea. It's a yellow spot. It's a comparatively dark area. It has 5.5 millimeter in diameter and situated at the posterior pole of the eyeball. It's temporal to the optic disc between the temporal vascular arcade. We can see in this picture. And histologically, macula is a region with more than one layer of ganglion cell layer. And Tripathi have recommended the term area centralis for the macula. And they are reported that area centralis is a horizontally ellipsed area demarcated approximately by upper and lower arcuate temporal retinal vessels. As shown in this picture, it corresponds to approximately 15% of the visual field, and photographic vision and color vision are primarily the function of this area. Oxygenated carotenoids, lutein, like lutein, zeaxanthin, accumulate within the central macula and give the yellow color. And these carotenoids have antioxidant capacities and also function to filter the blue wavelength of light. So they are preventing photo damage. The macular area or macula lutea, area centralis, it has three main areas like fovea, paraphobia, and periphobia. In this chart, we can see we already discussed macula is also known as posterior pole macula lutea, central retina area centralis. and fovea is also known as fovea centralis. And this macula, histologically, it contains 2 or more ganglion cell layer. Its peripheral limit is up to at the site where the ganglion cell layer are reduced to a single layer. And clinical observation and the size, it's a ill-defined area of 5.5 millimeter in diameter or 3.5 disc diameter or 18 degree of visual angle. Centered 4 millimeter temporal and 0.8 millimeter inferior to the center of the optic disc. And where the fovea is a depression in the inner retinal surface, the photoreceptor layer of which is entirely cones. And it's a concave on clinical observation. Fovea is a concave central retinal depression seen on slit lamp examination. It's a 1.5 millimeter in diameter or 1 disc diameter or 5 degree angle of visual field. And foveola in histological definition is like the central floor of the fovea where the inner nuclear layer and ganglion cell layer are absent. And in clinical observation, it's an ill-defined area of 0.35 millimeter in diameter or 0.3 to 0.4 disc diameter and approximately equal to the capillary free zone of the retina. And umbo is a small central concavity of the floor of the foveola. Its another name is light reflex cleavers like that. And its clinical observation, it's observed point corresponding to the normal light reflex, but not solely responsible for this light reflex. In parafoveal zone, histologically the outermost limit where the ganglion cell layer, inner nuclear layer and Henle's layer are thickest. That is where the retina is the thickest in parafoveal zone. And clinical observation, it's the area, the area of ring-like area of 0.5 millimeter in diameter surrounding the fovea. And parafoveal zone is the outermost limit of the parafovea to the outer limit of the macula. That is the perifoveal zone. And it's about a ring of 1.5 millimeter diameter surrounding the parafoveals. And fovea we discussed. Then margophobia. It's a margin of fovea. It can be seen biomicroscopically as a ring-like reflection of the internal limiting membrane. This fovea represents an excavation in the central retina. And margophobia consists of a margin and declinity of 22 degree and bottom foveola. Foveola we already discussed. Umbo we already discussed, is tiny depression and responsible for the visible foveolar reflex. And loss of foveolar reflex may be an early sign of damage, and the greatest concentration of cones is found in them. And the area is 150 to 200 micrometer diameter and referred to central bucket of cones. Clevius refers to the declinity extending from the margin of fovea to the margin of foveola, and it comprises peripheral vascular and central foveal avascular zone. Its foveal avascular zone, it's located inside the fovea but outside the foveola, and its exact diameter is variable. Its location can be determined with the accuracy only by fluorescein angiography. Paraphobia, we already discussed that it's a belt ring-like area, 0.5 millimeter, surrounds the foveal margin. Next, peripheral retina. Peripheral retina is also known as an extra aerial periphery. Can be divided into 4 regions: near periphery, mid periphery, far periphery, and extreme periphery. Near periphery is a circumscribed region of 1.5 millimeter width around the area centralis, that is macula lutea, and mid periphery occupies 3 millimeter wide zone around the near periphery. Its outer limits correspond to the equator. Okay, this is the mid periphery, 3 millimeter wide zone around the near periphery. Near periphery is 1.5 millimeter around the area centralis or a macula. Far periphery, it extends from equator to the ora serrata. And the width of this belt varies depending upon the ocular size and the refractive error. The average circumference of the eye is 72 millimeter at equator and 60 millimeter at ora serrata. The average